we had time to kind of look at one of our own. So, all right. Level 1 mock scenarios. Has anyone had time to do any of that? Yeah, I think we're all pretty much in agreement. And that may be something we may just need to sideline for a while and just kind of put on a back burner, because it is difficult to, with everything else we got going right now. And some of us, I mean, are still doing COVID roles as well. So that has not, it's slowed down, but maybe not stopped yet. All right, so I'll just kind of slip that off the agenda for right now. We can always revisit. All right, nifty analysis. I think pretty much I heard from everybody. Everybody wants to do this as a level 3 group. I talked to Olivia, and Olivia is more than willing to be the data person for us to do this. So we just have to, I've been trying to reach her to see, like, how do you want our data sent to you? Kind of what kind of format, you know, should it be in? What's going to be easiest for you? So that's the bugs I'm trying to work out right now. Soon as we get that kind of ironed out, I'll send something out to you guys, and we'll go from there. But otherwise, it's just going to be a matter of looking at our Kabaris and then applying the nifty criteria to it. And Sherry, for what we're talking about there is, there is a kind of a pilot going on with nifty stands for, oh shoot, somebody help me out. It's about intervention. It's basically the goal of it. So the measures injury, which is not always the most accurate, but doesn't measure acuity is the problem. Whereas what nifty does is you use standard Kabari, and then you apply these 5 criteria. And basically somebody's nifty positive if they meet one of these 5. And mostly it's to OR within 4 hours, massive transfusion protocol, transferred to a higher level of service. What's the other 2 we had? Trying to think. There's 2 other ones. We will send that. I'll send that stuff off to you, Sherry. If I think I have your email, but if not, try to get a hold of you, or you get a hold of me, and I will send those off to you so you can look at that. But as a level 3 group, we want to pilot this for level 3s. The level 1s and 2s, they don't have the transfer component in theirs. We've kind of molded that to what we look at as level 3s. And so it'll be interesting to see what that does for our over triage. All right, any questions on that? Okay. Rural education work group. This is a work group that came out of the State Trauma Committee. Excuse me, I'm all plugged up this morning. We have a couple of years ago, we got a grant, or we funded it. Basically, the trauma system funded a grant to look at the education levels for trauma education within physician, nurses, and EMS. And so those reports came back to us. We tweaked them a little bit, had the people who won the grant, we had them redo a few things for us. And now we have this report. Now it's like, what do you do with it? Okay. So we know we see some gaps, we see some of all this kind of stuff. So what the state committee decided to do was to form 2 little work groups. One was for just looking at the report overall. And there's a lot of little recommendations in there that we think that some of that's pretty low hanging fruit and can be taken care of. We also developed a rural, just looking at rural areas, and made a separate work group just for that. And so I chair that committee at that work group, excuse me, and we we have a kind of a wide variety of people from around the state. That's what we kind of wanted to have. Some are EMS, some are physicians. And we had our first meeting a few weeks ago. Basically kind of get the groundwork of, okay, how are we going to do this? And the easiest way we thought of was to just break it out by regions, because everybody in their region kind of knows their people in their region. Break it out by regions and then appoint one of the committee members to kind of look at that region and get a feel for the people there. Maybe there's critical access hospitals in your region, giving a call to that ED director or whoever and seeing, you know, how is your education for trauma? You know, what are you doing? What barriers do you have? You know, what is there anything that can be done to help you from a state level? That's kind of where we're at. So we're meeting again in May, but in between time, what we're doing is each of us who have a region are contacting those people and seeing what needs are out there, what gaps exist, and then we're going to report back to the committee. The big thing with this, and of course the big concern with this, is already centers are, and regions, even regional systems are kind of, some of them are pushed to the max with education already. So it's like, you know, is this going to make more work for, you know, we don't know what that looks like yet. It's not the goal. The goal is not to make more work for somebody. The goal is to make things available and try to find ways to bridge that gap for these people. So any questions on that work group? All right, that's where we're at. Okay, Ms. Shannon, I'm going to turn it over to you now, and please enlighten us. Take as much time as you want to enlighten us. I wanted to leave you the bulk of the meeting here, so let us know here about your visit.
All right. Has anyone else besides me gone through a virtual re-verification yet? Anybody?
This is
Itzy from Western Reserve.
Oh, go ahead.
I said this is Itzy from Western Reserve. We had our very first provisional visit, so they'll come back in 18 months, but we had ours on March 11th.
Excellent.
March 11th was a busy day, sounds like, because that was when we had ours, March 11th and 12th. Anyone else?
Yeah, this is Marion Landry. We didn't have, we actually had our focused visit last month on the 23rd.
Okay. How did it go?
It went well. We had, our initial deficiencies were PI, but they felt like we've set a good, you know, a good foundation on what we've learned, and we've grown a lot in the last year, I think, and hopefully they're going to, they said they're going to recommend to the college that we remain, you know, at level 3. So it went well. It was our first time, you know, our first time all doing the Zoom, and the OneNote was fun.
Right. We were talking about that.
Yeah, I heard you guys talking, so I feel the pain.
I'll tell you a little bit about what they said to us and what they liked that might help the rest of you. We had Dr. Adrian Mong and Dr. Ali Salim. We affectionately termed them Harvard and Yale because that's where they were from. And so it was funny. We'd say, did Harvard and Yale email you yet? And, you know, it was just cute, but they were as nice could be. Dr. Ali Salim was our lead reviewer, and he was very fair, very engaged, very encouraging. And I really liked the way I think we lucked out. And in talking to Vic Graymeyer from COTS, she said if she could have handpicked anybody for us, it would have been him. She had worked on him and or worked with him for several re-verifications and thought he was thorough but very fair. And that's exactly how I found him to be as well. And to that, so if you get them, you've hit the jackpot, really. They were, like I said, thorough, and they went through our cases. They ended up, of the 25 that met the criteria, they ended up choosing 20 of those 25. And so I'll kind of start share a screenshot of a couple of things for you. I'm going to show the first, the PI form that we use. And Diane, we kind of got this idea in talking with you and how you do your PI. And so I'm grateful for you sharing that with us, because these are one of the things that they really, the reviewers really liked. And so let me share my screen and pull up the level 1 review form real quick. And this is what Ashley and I use to review charts. Let me know if you guys can see this. It'll say patient name at the top.
Yes, we can see.
So this has actually been added on a little bit too. We have trauma admit, trauma consult, medicine admit, discharge from the ED, but this is basically it. We look at the pre-hospital phase. Did they have a C-collar? Because I don't know about you, but this is most of where our pre-hospital fallout, not so much protocol issues. Sometimes they have difficulty with managing or putting in an airway, a definitive airway. C-collars are probably our number one issue here. And then we put, just a little bit about their mechanism and their history. And then these are basically a checklist of all the things that we look for based on the guidelines that we follow. Were they in the ED? Were there airway management issues? How come? Did they use our order sets? Were they screened for alcohol? Did they get an antibiotic? You guys know the drill. Did they give the tetanus shot? But the reviewers called this out, that they really liked this. They recognized that it's probably time consuming for us, but it was just one of the things that they mentioned that they like. And usually when I get follow-up emails, instead of attaching separate sheets of paper, sometimes I will copy and paste the follow-up emails right here. So it's with the PI form. So when our medical director is looking at our PI, they can see, what we did, what the loop closure was attached to this form. That's that. And then a little bit about the OneNote. This was just one of the sections that we used. This was our PI section. The other thing that they really liked was this loop closure tab. So not only did we upload the loop closure to every individual case that we had, Dr. Chow insisted that we make this review as easy as possible for the reviewers. And that meant putting everything where they could see it. And that meant, like, if you scan in a document into OneNote and it came out sideways, he wanted us to, we had to screenshot it and whatever and make sure it was turned the correct way, so that all they had to do was pull it up. And so anyway, I thought, well, maybe we should do a loop closure section and then list all of our issues and kind of tell on ourselves and list all of the issues and then the loop closure things that we had. And so I created this loop closure form, which is this right here.
I left a message on your machine. It's open today, closed the weekend. Okay.
And so if you guys can see this loop closure form, it was just what was our issue? When did we notice it?
You want to do it?
And
Thanks,
I'll be honest, there was a loop closure issue that we didn't notice, or there was an issue that we noticed, but we didn't notice it until late in 2019. And so because we noticed it late, I just went ahead and put here, we didn't notice it. And then we went back through our charts for 2019 and noticed it had happened several other times that we didn't catch until late in the year. They actually didn't say anything, negative about that. I mean, we just, I probably overshared because 1, it was my first re-verification, and 2, I was nervous as all get out. But that was one of the things that they liked, excuse me, is to be able to see the loop closure section. And then I just listed out all of our issues. Does anybody have any questions about that.
So the OneNote, I guess I just have a question. So the OneNote, is that what they ask you to use?
Yes, that was on when they sent the instructions on how to upload our reports. It was OneNote that was recommended that we use. And so that was kind of fun trying to figure out, because I had never used it before. But I'm lucky enough to have my PI coordinator and our NP, trauma NPs, figured that one out and figured out how to upload all of that documentation. And so all of our charts, every single piece of the chart had to be uploaded into OneNote. And we kind of did it like you see here. Let me get this out of the way and upload. Oop. Like our patient names would be here. If you can see that here in OneNote. We put our patient names here, and then every section had like the run sheet and the H&P and the, you know, the clinical documentation that they asked for. And then we added the little loop closure piece at the end.
Shannon, can I ask one question?
Sure.
For me, the most challenging part right now, loading into OneNote the chart pieces, are the progress notes. Did you guys find those challenging? You know, trying to keep them. It's how the page breaks when you put them in there. That might just be something I'm doing wrong, but.
No, is Ashley on? Ashley, if you want to speak a little bit about that. Not sure she's.
That's okay. I can reach out to her.
Are you converting them to a PDF when you're uploading them? Because if you convert them to a PDF, like if you go to print and print to a PDF, you shouldn't have issues with your page changing. And if you do, you can go in under the PDF and organize your pages. Because I uploaded all we didn't use OneNote. My surveyor specifically asked us to not use it because he didn't have it. So he just said, I said they prefer us to use OneNote. And his exact response to me was, what is OneNote?
And so, yeah, we did, that was the piece that we did do, is converted to PDF in order to save it. And so that helped us, you know, after that. But I think our reviewers were, they knew what OneNote was. They weren't as savvy with Teams. We did end up uploading, and I had an IT guy glued to my hip. We took OneNote and actually loaded OneNote into Teams and then shared it in the cloud with the reviewers. We just gave them access to it, like we were all on one team within Teams, Microsoft Teams.
So at UC, we have had some challenges with that being blocked from an outside, you know, the outside UC. So we had to work through IT with that. And actually we found the solution ourselves, but that has been challenging. They were even blocking my notebook originally with my physicians, because that's considered outside.
A shared content. Yeah. Well, the same. And then we actually, our IT guy had to get us more room within OneNote, because when we started uploading, he said, holy cow, you guys have a ton of data. And so he had to actually help or make it larger to be able to hold all the data for just those 20 charts. So yeah, that was another. So I recommend, you know, having an IT person glued to your hip.
UC will not let us send OneNote out. It has to go in I have to drop the notebook into something called Hitachi. They use, that's what they put like legal documents, and then it sends a link. And I too have not had enough storage. So I've had to ask for more storage.
Oh, wow. We had to vet OneNote through legal. And as long as we had it in Teams and it was a specific channel, we had to get permission to create our own channel in Teams just for trauma program staff and the reviewers. So those are the only people that had access to that data. And then after that, just to tell you a little bit about the 2 days. So what they did at first was, obviously it was a greeting and that kind of thing. We were on Teams. We had a conference room. And then what we found that was most helpful was to have headsets, because in that conference room, it would pick up just about anything and start to echo and so on. I'm sure you found by using Teams that could be a thing, but we wanted to be all together but socially spaced. So we had a huge conference room that we usually would have our peer reviews in and things, but we were distanced. But again, headsets made the big difference. But for the chart review portion, we wanted Dr. Chow and I to be able to see what the reviewers were looking at. And so we had our trauma APPs were used as our navigators. So the reviewers asked for for each of them to have a navigator and then a site coordinator. So we used the administrative assistant that usually runs our trauma peer and trauma committee meetings. We had her as the site coordinator. We had 2 of our trauma APPs as the navigators. And that way, Dr. Chow and I were freed up to be able to run here and there for questions. And again, we were in the same room within sight lines of both of the navigators. And we had their computer hooked up to the large screens in our conference room so that we could see what patient are they on and what they were showing them, as well as be able to overhear what they were talking about. Then we also utilized one of our registrars and our PI coordinator to be sitting kind of off to the side of each navigator so that they could, if they heard, oh, you have a question or something that would cue Dr. Chow or I in to know that the reviewers might have a question, and so that they could just flag us down and whatever. And we found that we also used paper, to hold it. Like if we overheard that there might be a question, Dr. Chow was writing the answer and like holding this up. And so it was kind of funny and fast-paced and nerve-wracking and all those good things, and confused the heck out of our navigator or APPs. But that's kind of how we did things, as well as, so I just made sure I had a bunch of blank paper and markers and pens or whatever if we had to hold up cue cards for the navigators. And so it worked out. We did, in teams, we could split off into separate quote unquote rooms. You know how you do that, and you or if you haven't done that before, we practiced for a solid 3 weeks beforehand. And so the site visit coordinator had to break us into our own rooms. One of the features in Teams that we didn't know was there and kind of stumbled upon was that once we broke out the reviewer and the APP into their own meeting room, we could give them permission to hit the button to come back to the main room. At first, we were trying to figure out, well, how are we going to know if they have a question? Is the APP just going to flag us over, or what's that going to look like? But we found out in Teams, if that's what you're going to use, is you can give them access to a button that allows them to pop in and out of the main Teams room, so that we would just get flagged when there was a question coming, and I would run back to my computer and put my headset on, and then the reviewer and the APP would pop into the meeting room, ask the question, and then go back into their own little meeting room when the question was answered. Because they had already reviewed the charts the week prior to our re-verification, that part went fast. I think 2 hours total, maybe, to go through that section with both reviewers. Now, they did allow for, maybe a reviewer would have a question for Dr. Chow at the same time. So they did take take turns and whatever. But that actually went a lot faster than was budgeted. I think they budgeted 4 hours or so for that. But because they had already had they came with their questions basically, that section went really quick. So that was good. And, I thought, oh man, or, Dr. Chow said, are they already going to have their mind made up whether we passed or not, by the time they come? But they seemed fair enough that they did take our answers into consideration. And then let's see, then the second part of the day, how it is getting surgeons all in the same room at the same time for peer is challenging, let alone on the same, Teams meeting at the same time. And so Dr. Chow had us verify, number one, where were the surgeons going to be logging in? Were they going to be at home or were they going to be on site? And if they were at home, he had me verify the bandwidth they had at home, because that sometimes things can go wonky on a Teams meeting or on whatever platform you're using if you don't have the bandwidth to support it. If you get so many users on the same bandwidth, you could have issues with either audio or video. So he made me, make sure that their bandwidth was accurate. In order to do that, hey, honey, can you hand me my phone over there, please? Sorry, I'm having my husband fetch me my phone from across the room. A second. So in order to do that, if you guys have not seen this app, it's called Speed Test. And it's just something on your phone that will test it's an app that tests the accurate or the your bandwidth and your speed to make sure that your internet is appropriate. And it just looks like a, if you can.
Shannon, do you mind typing that in the chat?
Yeah, I couldn't hear what you called it. I'm sorry.
That's okay.
That way I've got the spelling right.
That's certainly just 1 second.
Thanks, appreciate it.
Speed test, and it looks like the old-fashioned dial on your car. Let me see if you guys can see this on the app on my phone. It is this one right here. And that way you can verify the bandwidth. And that's what I had the site coordinator, our AA, well, she's not mine, but I loaned her. As the other thing, the budget that we saved for the re-verification visit, I actually paid in APP salaries and administrative salaries, because I had to loan those employees in order to help me, because as you know, our programs are small. So I got that passed only by telling them, hey, look, we're saving the review dinner, which would have been very expensive. We're saving money with that. And we're saving money with buying gifts and putting them in a hotel and, yada, yada, to be able to lease employees in order to help us with re-verification. And then, so after we verified the surgeon speed test and where they were going to be, we actually did 2 practice runs with the surgeons. Like the week prior to the re-verification visit, we had the doc sign in for about 10 minutes on that channel that we had created for Teams, just to be able to make sure that we could all get on at the same time and there were no issues. And we had the IT guy with us as well. And it worked out. I mean, of course, the one surgeon that it absolutely worked on day, on the 2 practice days, and then come to re-verification and all of a sudden we couldn't see his video. But those things that make your eyes roll. And you know, or out of your control. So they met with each of the docs, and I'm probably certain that on Teams it wasn't as thorough as it probably would have been at a review dinner, you know, with everybody sitting around and relaxed. But there were some pointed questions, and that didn't last very long either. I think the reviewers were very cognizant of the surgeon's times, and so all told, I think that first day we were done, I think by 2:30. And so it was still nerve-wracking, but not as long of a nerve-wracking experience as we expected. And then the second day was our virtual tour. And let me tell you a little bit about the setup that we kind of came across. We talked a little bit about whether to use a handheld, a phone, you know, because I heard some people have used iPhones or iPads or whatever. And I was just afraid that, you know, I know how my surgeon walks and talks, and, you know, the thing would have been all up here and, you know, everybody would have gotten dizzy. And so anyway, we ended up getting a cart, one of the carts on wheels. I don't know what you guys call it in the hospital, if your nurses document on carts on with the cows or the wows or whatever it is you call them. The IT had come up with that. We had gotten a brand new cart with a video on it, and he had a video camera that he put up at the top. So that made when we were pushing it down the hall was very smooth. And so then we bought one of my trauma APPs bought a microphone off the internet. And so we were able to clip it. It was a wireless mic. So, because, you know, with masks and things, if they wanted to ask a question of a nurse or administrator, it was very difficult with masks on to be able to be understood. So we wanted to make sure that they were completely understood. So bought a wireless microphone to attach to that computer on wheels, so that all I had to do, or Dr. Chow had to do when he was talking, was just hold that mic up to his mask so he could be understood, or, you know, go like this with the microphone, and so some, you know, whoever they were asking questions of. And then we did 2 or 3 walkthroughs of the hospital and had a route mapped out completely, so we knew exactly where we were going and where the dead zones were. We found out in the PACU there was a dead zone, but the Lord was gracious to us on the day of re-verification, and we didn't lose them even once. In all of our practice runs, there were 2 dead zones, like the elevator and the PACU, where we lost connection, but we didn't lose connection at all on the day of verification. But we knew that where they were, so that we could say to the reviewers, hey, we might lose you, and here is our backup plan. You know, we're just going to reconnect if we lose you at this spot. I had also made a cell phone list and a bat phone list that I had on the cart on wheels, just in case we did lose somebody and couldn't get them real quick. We had cell phones and people beside me who could make panicked phone calls if we did lose folks.
Yeah, so for this, we actually use the iPad, and on Amazon, they sell a stand that's like it's like $100 that we utilized to push our iPad in, and then we bought a wireless speaker and a microphone that we utilized. And knowing that we had to get in elevators, what we did is my site coordinator, which is like the administrative assistant, we use Zoom, not Teams. She logged in so that even if we lost connectivity, the meeting never went away. We would just dial back in. But we had 2 iPads and one on each floor, so that like if we had to go into an elevator, even if we lost them in the one in the elevator going up or down, whatever floor we would go to, there was another iPad there waiting that was already logged into the meeting. So that really helped us tremendously there. And the iPad stands are nice because we use telehealth for a lot of things, so somebody else can utilize them within the facility. But that worked out really well for us, is having like one person, you know, my site coordinator logged on. So even if we did lose it, the meeting was still there. We'd let them know we might lose them, but that really helped us as well.
Nice. Oh, good. I'm so glad that worked out. Yeah, it was just, we were afraid with if we tried to hold something that, somebody would need a cigarette and have to,
Yeah.
be
No,
jugging.
the stands were really nice. They roll smoothly, and they were super cheap. I mean, because I know everybody's broke at this point in time. They were like $100 or something, and we did the tour, the mock tour with them, and then we did the second tour, and they had zero complaints about how it flowed or being, dizzy or anything like that. So
Nice. We also had 2 runners ahead of us. We used our registrar and our PI coordinator to run ahead to the next area to hold elevators as we were coming, and to run ahead to the next unit to say, hey, they're on their way, everybody hide, how the drill goes. And so that worked out as well. And so, and then they took notes the whole way. So we made notes of what questions were asked, what went well, what didn't go well. So we did that as well. And then, so that took, I think we took about an hour and a half. And then the questions again were pretty standard. We also had sheets of paper on the cart on wheels so that, when our radiologist was stumbling over answers, we could, give the whole answer behind, kind of cue them in. But otherwise, it went pretty well. I have to say, I'm grateful for the experience. I mean, it was about as nerve-wracking as nursing school, but I'm glad that that was my very first re-verification, and so now I think things that we would do differently, obviously lessons learned, is just to be as prepared ahead of time. Have your PI in one spot. Have your, instead of trying to look for emails. And I'm sure those of you who've been through this before know absolutely how to do this. This was just the first timer. And of course, the data that they used was my first full year as a TPM. And so, of course, you're looking back at all those charts and wanting to weep with, oh, how young, oh, how ignorant I was, And so just have all your PI in one spot with each chart as you go along. And that way you don't have to hunt and peck for, emails and loop closure. Make up the loop closure form as you go. That way you can, everything's right there. You don't, again, have to hunt and peck. So it's all in the preparation. And I know you take Topic and Optimal and all those places, they tell you those things, but until you've been in the weeds, it's difficult to know what to say until you've actually been through it. So I hope that actually helps somebody. Does anybody have any questions for me specifically? Anything I might have left out?
I have a couple of other questions. It's Jenny. How big was your room where you put everybody? So you had no issues with feedback with everybody with their headphones?
So we had 4 conference rooms that were about the size, I'm trying to think, we could get 8 socially distanced people in that room. So was that 80 feet at least? Okay. So our APPs are rather loud. Yeah. And so we had one in one corner on the right side and one in the other corner on the left side. And we partially closed, we have soft walls.
Yes, us
so
too.
We partially closed those soft walls so that one APP couldn't really hear the other. Yeah. They also had headsets and their computer. But trauma folks, we're all kind of loud. Yes. And so then in the middle of that, so we had APP, and then in the middle, we had 2 tables set up. I was here, Dr. Chow was here, socially distanced, but within visual view of both APPs so that we could see if they start waving to us or whatever. And then out of sight of the APP and reviewer, like the APPs were facing us and we were here. And then out of sight of the APP's camera was the registrar over here and the PI coordinator here. So we were kind of here, here, and here in an 80-foot area. So we had visual sight lines. We could kind of hear each other, but, you know, of course, Chow and I were jumping up and going, you know, from one corner to the other, straining, listening. We had all of our patients and paper, just so that every time the reviewer would go to a next patient, he and I already knew, and this is probably what I would have done, is made 2 copies of those paper charts. So, because then he wanted one and then I couldn't see one, and you know what I mean? And so we had those paper charts laid out with the PI form and like the case summary, so that as soon as we heard the reviewer going to the next patient, we snagged up that paper so that it could remind us of who that patient was and what our issues were, and try to anticipate what questions they may have for us. So yeah, I definitely would make 2 copies next time.
Thank you.
Sure. Anybody else have any questions?
Well, Shannon, hey, this is Carly. Thank you so much. That was really good information. Would you be willing to be on our panel? We're going to do this kind of like a panel discussion on virtual visits for our May education session. I think a lot of the information it's not level 3 specific, but I think you have so much good tips and things that you did, if you'd be willing to be on that panel in May.
Sure, I was going to say it just depends on the date, but yeah, if I'm able to make it, I'd be happy to.
Perfect. Thank you. I'm just recruiting our panel members, and I'm like, we have to have you. Thank you.
Sure, glad to help.
Shannon, this is Diane. Thank you very much for that. It was really good. The one question I have is the PI form that you created. Would you be willing to share that with this group in case there's others who would want to model something or format it to their own thing?
Absolutely. I'll send you the PI checklist and the loop closure form. In fact, they listed that PI checklist as a strength. I have they already got back our March 11th and 12th was our visit, and they sent our the review consultation results to us just a few days ago. So that was pretty quick turnaround time. And they actually wrote that that was a strength for us, was that checklist.
Yeah, if you can share it, then people can kind of tweak it to their facility or how their policies and their protocol is. I think that would be great.
Sure. Alex, if I send that to you, would you mind getting that out to everybody?
Yep, I can absolutely do that.
Awesome. Thank you.
Any other questions for Shannon? All right. Thank you again, Shannon. You're a rock star. And I'm glad everything went so well for you. All right. We got a few minutes yet, so we will buzz through this here. Level 3 spreadsheet. I'm going to turn this over to Alex. This was Alex's little project. So go ahead, Alex.
Okay, so if you guys remember at the last meeting, I kind of brought to the group the idea of putting together a spreadsheet that just has different kinds of information specific to level 3s, just because we're so different, and I times when we're kind of being evaluated, especially by administration. It's really hard to explain what other centers are doing across the state, and that might help us, whether it's, every other center has a PI coordinator, we need one too, or just kind of being able to compare and show the strengths of level 3 centers. So the thought was putting together a document, a spreadsheet that kind of has different data points of all the different centers, all the level 3s across the state, and then having all the level 3s having access to that, so we could potentially utilize that for whatever we needed to do. So I'm going to share. My Teams is moving really slow, but I'm going to share my screen here in just a second. So I put together, I just kind of sat down and thought about different things that we might want to have on this spreadsheet. Definitely not end all to be all. So I just wanted to run through it really quick and get some thoughts. And if you guys had things that you wanted to add, things you wanted to take away, feel free. Can everybody see my screen? I'm not sure if it's sharing. My little red line went away. Can you see?
It's black.
No.
Okay,
Yeah, it's black.
let's try again.
Here we go. I see it.
Okay. All right, so the first section, I just had some annual data. Doesn't have to be annual. It could be every 3 years or whatever we decided. But this is the section I kind of put together for that. So I don't know if anyone has any comments. It's total trauma volume that's in the registry, number of highest level activations, number of trauma surgical cases, number of cases to the OR within 24 hours, number of admissions, number of transfers, number of ISS greater than 15, and number of admissions with an ISS greater than 15 or 25. I just kind of thought, just to see like how high of an acuity are we keeping in our trauma centers. So I don't know if anyone has any thoughts on that, yays, nays, things to add, take away.
I'm glad you're doing this because we are benchmarked through our system and something called the Altius report. And they told us that, they were basing our FTEs on the level 3 benchmark when I was trying to tell them, and I actually had the reviewers kind of back me up on this about our what they're going to require as far as a registry is concerned with our volumes. And so that was very helpful. But up until then, I wasn't meeting my metric based on their, benchmarked Altius report because, they were telling me I had too many staff. And when you only have one TPM, one PI coordinator, and 2 registrars for a volume of almost 2,000 patients a year, that's very hectic. And so it would be good to be able to show them, administration this, and maybe they need to change the benchmark, especially now that the ACS is requiring us all to have more registrars.
Yeah, I agree. I think, and the idea kind of came, I think I was in a meeting and they were talking about level 3s, and you could tell that they didn't really have a good idea, but I didn't have anything that I could flat out show like, hey, we have, 5 centers that do have neurosurgical capability. We have some that, see 3,000 a year. And so that was kind of where the idea came from, to be able to show these different entities kind of where our center lands in comparison to other level 3s. So thank you. So any thoughts on that data section? Do you think annual would be sufficient? Should we update it every couple years?
I mean, I don't think it'd be hard to update it annually.
Okay. Yeah. Try not to have too much, so our registrars won't strangle us. But ISS with greater than 15, or do we want a different number?
I think that's good.
Okay. All right. So then the second part is program information. So this is just kind of, again, how your program is set up, the breakdown. So initial year of verification, so we can kind of see like how long everyone has been a trauma center. Then number of budgeted FTEs, just overall. Number of trauma registrars. Then of course that would tie in with the above of the annual volume. Then number of trauma registrars that work in-house, and especially now with COVID versus work from home. So I can add that if that's a thought. Then does your program share registrars with another program? since we do have centers that are part of systems and there may be a sharing that happens between the registry. Is the trauma program manager full-time? Is the trauma program manager dedicated, or do they have shared program responsibilities? Some programs also do stroke, some do also do EMS, cardiac. So if you do have shared responsibilities, what are those shared responsibilities? Who does the trauma program manager or trauma program report to directly? Do you have an injury prevention or outreach FTE? Do you have a PI FTE? Do you have a trauma APP? How many, if so? Does your program have its own budget, or are you looped into another budget? How far are you from another level 1 or level 2? And are you within a health system with other trauma centers? Any thoughts on that section or things that you'd like to see added?
Hey, Alex, this is Carly. Could you add anything about like an education FTE?
Yes. Let's see. Anything else? Take this away. Okay. So if not, I'll go to the last section. This is just your capabilities. So number of trauma surgeons. Do you have a backup trauma call? Do you have in-house surgeons? Do you have residents? And if so, what hours are they available? Do you have a number of ortho surgeons and then residents? Yes or no? Then neurosurgery, if you have neurosurgery per what the ACS considers for having neurosurgery capability. And then if so, how many do you have? If it's limited neuro capability, describe that. Number of platelets that you have on site, that always kind of pops up for level 3s as a challenge sometimes. Inpatient rehab, in-house rehab facility. Do you admit pediatrics? And if so, how many a year? Do you have anesthesia in-house? Do you use a CRNA? And then do you have any of these other specialty services? So any thoughts on that last section?
Do you want to maybe under specialty services add like an other in case there's something?
Okay. Anything else? And any other thoughts on it in general? Does everybody feel like this is something that they would want to participate in?
I think this looks really great, Alex.
Thank you.
Yeah, we'd do this.
I'd do this too, especially since I just filled out the PRQ and know all these by heart.
Okay, so what I'll do next steps is put it together on an Excel spreadsheet and figure out what the best way will be to get that information out. I don't know if I'll send it out as a survey, and then as people fill out that survey, then I'll just fill out the spreadsheet or just share the spreadsheet with you guys to plug in what you need. So I'll work on that. And then I will send that to Diane so she can get that out to you guys. And thank you.
Thanks, Alex.
Thank you, Alex. That's great work. I think that'll be interesting. It'll kind of give us a little feel of what Ohio level 3s are and what capabilities they have. And it's just kind of interesting. We are all very different in, we have some urban level 3s and we have some very rural level 3s. And so it will be interesting to see how that all plays. Okay. Education, Carly.
Yeah, good morning, everyone. So Shannon kind of stole the thunder. So Alex sent out a survey to the group. So we're going to be doing just to do the survey, she'll resend it out. We're going to do a panel discussion on virtual visits for our May session. And then after that, we're going to kind of tier out Our plan is to break up education kind of like we did with the drill downs for like Epic Narrator or some kind of electronic trauma flow sheet documentation. So the survey will be coming out, getting kind of what people want to know about it, if you have it, feedback, so we can compile it, break it up into what the group's plans are and how we want to present the education. But moving forward, it'll be May for a panel discussion on virtual, and then go into the electronic documentation education piece. And then we're still open for ideas. Please send any ideas, suggestions. And once the new book comes out, whenever that may be, we will do chapter breakdowns in conjunction with our sessions as well.
All right, excellent. Thank you so much. All right, very quick roundtable. Anybody have any questions?
Actually, I have one. I'm just curious how many of you had sent your registrars home during COVID, and if they're still working remotely, or I know Barb, you told me you had brought yours back. Did anybody else still have their registrars that are working from home?
Yes, ours are still working from home.
Yeah,
Ours are still at home as well.
I think ours will stay there. Sounds like forever.
Ours are.
I love them there.
Ours are at home primarily, but they do come in for any kind of updates and services that we want to do. So we have them
Sounds
come
like
in,
our
I think,
introverted
average about once a week.
registrars. Yeah, it sounds like all of our introverted registrars are like working from home.
Mine
Thank
enjoy it a lot. And we saw productivity increase significantly with working from home as well.
Thank you.
All right, anything else anybody has? All right, as usual, fantastic job, guys. You guys are a great group to be a part of, and always honored and humbled by y'all. All right, Alex, I'm turning it over to you.
Alex, I think you're muted.
I am sorry. Thanks. So I was saying, I'll give everybody probably about a minute or so, just to kind of, as people filter in, and I'll pull up some of the documents in PowerPoint, and then we will call the meeting to order. Let's see here. All right, can you guys see my screen?
Yes.
Okay.
Yes.
All right. So we'll go ahead and call the meeting to order. So as first order of business, any new members that we have on the call today, is there anyone that has not ever been to an OSTNL meeting before? Nope. Okay, no new people. All right, well, moving on. So I have had a couple challenges with getting the list of all the OSTNL members. The last meeting, there was a bunch of people that fell off the list for the meeting. So for those that were not invited to some of the previous meetings, I apologize for that. But what I did do is I went through and made sure that I looked up every single trauma center and provisional and centers seeking provisional status throughout the state based off of the trauma committee list, and went ahead and made another roster to make sure that we had everybody on the list that we needed to have. So I wanted to take a second just to, before we do roll call, just to show this roster and make sure that I have everybody, because I definitely don't want anyone to miss out if they want to participate in OSTNL. I had a couple email addresses, of course, with people changing names and getting married and so on, that I wasn't quite sure who everyone was. So I just want to take a quick second and run through this and see if there is any changes that you guys notice. I'm sure it's probably not the biggest font wise, so I'll try and make it a little bit bigger so you guys can see. Is it legible? Okay.
It is.
Okay. So if you guys can, I'm not going to go through every single one because we'll be here for a half an hour just running through this. But if you happen to see somebody that it doesn't look right as far as who the trauma director, manager, or coordinator is, just put it in the chat or let me know so I can update it. The other thing I wanted to incorporate was also PI. We did talk about at the last meeting wanting to start incorporating PI coordinators into our meetings, and also maybe having some type of subcommittee for PI coordinators. So I wanted to start getting a list of the centers that have PI coordinators and who those coordinators are, and their corresponding email addresses. So if you do have a PI coordinator, just shoot me an email of their name and their email address, so I can update this spreadsheet, and then as we move forward, start sending out invites to them as well. So one of the first questions, I don't know if Amanda from Mercy Health is on. Let me look through and see if she is on. I don't think so, unless she's on the phone. Does anyone know if this is her email? Because I have Amanda Taylor, but then I have a different last name for email. So I'm assuming maybe change of name, but not sure. So I don't know if anyone knows offhand. And I'm looking.
Alex, I mean, we have Amanda Lensick here. She works downtown.
Okay, so she's not with Mercy.
Not with St. Vincent. She's
okay.
With she's injury prevention and outreach for St. Elizabeth's.
Okay. That's why I wasn't sure if that was the same. So I don't have an email for the TPM at this facility. So she's for you guys.
Yeah.
Make note of that. So I'll see if I can reach out and find an email for her. Then for Mercy Health Lorraine, looks like Kristen Sugar had email to send correspondence now to Kelly Owens. I'm not sure if Kelly is on, but if anyone knows if Mercy Health Lorraine, if they are in a region, I'm also looking for that as well.
I'm here.
Okay.
Yeah, I think we're in a region. I have to double check it, but I can get that to you.
Okay. Yeah, if you can just shoot me an email, that would be great. And then same for Metro Health Parma. I'm not sure of the region and not 100% sure of the TPM. So I don't know if anyone knows or if anyone is on that is the TPM at Metro Health Parma.
I have that information too, if you want.
Okay, yeah, if you just shoot it to me, then I will update this.
Gotcha.
Last couple, St. Luke's is a new center that is just inquiring about trauma center designation and verification. I did extend an invitation to Ginger, but I'm not sure if she was able to get on. So I'm looking for if they have regional affiliation there, as well as UH, Elyria Medical Center. Danelle, if she is on, looking for regional affiliation there as well.
Alex, this is Diane. St. Luke's would be Norder.
Norder, okay, perfect, thank you. And then it's a UH Parma. I am not sure who the TPM is for UH Parma.
Alex, this is Julie from UH Portage.
Mm-hmm.
First of all the UH locations are in Knox.
Okay.
UH Portage is in Knox and Norton.
Portage, Knox, and Norton. Okay.
Mm-hmm. The TPN for Parma is Jack Myers.
Okay. I actually had his email down here. I wasn't sure. I thought it might be him, but I will just copy that over. Okay. Okay. And he is on the list, so I will add that.
And they have their visit next Thursday and Friday.
Oh, okay. Awesome. Right. And then Itzy, I know you are on. Do you guys have regional affiliation?
Yeah, I sent you an email. We belong to Norton.
Okay. All right. Thank you.
You.
All right. Thank you, guys. So I will update this with everything that everyone has sent me. And then what I will do is probably put this on the OSTNL website under the members only section, and possibly see about getting it on a shared drive. So you guys can go in there and update as things changes and review your facilities and make sure, you know, if there's anything that needs to be updated, so we can keep a running list. And so as we change over from officer seats, that there won't be a big gap of people being left off of meetings and so on. So that is it for that section. So I'm going to just run through and do a quick roll call and intro for everyone that is on. I'm going to start with just off of the list here. And then we'll go through and see if for the phone numbers to see who everyone is. So go ahead and just introduce yourself. I'll just call through who I see on the list, and then in what facility you are at. So I will start with Diane.
Hi, Diane Simon from Defiance Regional. We are level 3.
Thank you. Kendra.
Hello, Kendra from Suma Health, Akron City. We're level 1.
Thanks. Sandy.
Sandy Crossley. I'm from University Hospital's Cleveland Medical Center. We're in adult level 1.
Okay. Andrea.
Hey, Andrea Light from Mount Carmel East in Columbus, Ohio. We're in adult level 2.
Okay. And I have Ashley Rashawn.
Hello.
Hello.
Hi. Sorry, I was trying to hit my unmute button.
Oh, that's okay.
She is my PI coordinator at Genesis Healthcare System in Zanesville, Ohio.
Awesome. All right. Jenny Brodsky.
Hi, Westchester Hospital, level 3 trauma center.
Melody?
Hi, good morning and happy Good Friday. I'm Melody Campbell. I'm from Kettering Medical Center. We're level 2.
Christy Clark?
Hi, it's Christy Clark. I'm the trauma manager at Fort Hamilton Hospital, level 3 trauma center provisional right now. First verification next year.
Awesome. Carly Coleman?
Good morning, Carly Coleman, Grandview Medical Center, level 3.
Marianne Edwards?
Good morning, everybody. Marianne Edwards, Cleveland Clinic Hillcrest in Mayfield Heights, and we're an adult level 2.
And Barb Felton?
Hi, I'm Barb Felton. We are level 3. I'm from Marietta Memorial Hospital.
Lynn Haas?
Lynn Haas, Cincinnati Children's, level 1 peds.
Claire Hardman?
I'm the new PI coordinator at Atrium.
Welcome, Claire. Julie Warholic?
Julie Warholic, UH Portage Medical Center in sunny Ravenna, Ohio.
Judy Keefe?
Hi, I'm Judy. I'm Cleveland Clinic Akron General Hospital, level 1.
Tracy Knox?
Good morning. I'm Tracy Knox. I am from Upper Valley Medical Center, and we are having a consultative visit in July.
All right. Marianne Landfried?
Marianne Landfried, St. Joe's Warren Hospital, level 3.
Beth Larson?
I'm Beth Larson from Maya Valley South, and we are a provisional level 3.
Jenny Lemick?
Hi, this is Jenny Lemick. I'm at the University of Cincinnati Medical Center. We are an adult level 1, and our re-verification visit is the 20th and 21st of this month.
There's a lot. I think there's a 10 to 15 centers that are either doing provisional visits or verifying or re-verifying in the first 6 months of this year. So everyone's kind of under fire. Deb Miller? Oh, Deb's getting a bunch of feedback. I know Deb, she's with registry at Upper Valley. It sounds like her mic was getting a bunch of feedback. Ann Monick?
Hi, Ann Monig. Happy Friday, everybody. Trauma program manager at Miami Valley Hospital, adult level 1.
Cynthia Nagel?
Good morning. Cynthia Nagel with Ohio State and Ohio State East Hospital, level 3 trauma center.
Kelly Owens?
Good morning. I am at Mercy Lorraine. We are a provisional adult level 3. Our site survey is due for October this year.
All right. Caitlin Richard?
Hi, this is Katie Richard, level 3 trauma center, Blanchard Valley Hospital in Findlay, Ohio.
Shannon Kammick?
Shannon Kammick, TPM, level 3, Genesis Healthcare System in Zanesville.
All right. And Itzy Ray?
Hi, it's Ray, Western Reserve Hospital, Cuyahoga Falls, Ohio. We just had our provisional site visit on March 11th.
Okay. Sherry Nuski? I might not have said that right.
Yes, you actually said it right.
I did. Okay. I thought so, then I was like, ooh, maybe I didn't say it right.
You sure did. I work at Alvin Hospital. We're a level 2 trauma center.
All right, Sherry Johnson.
Hi, I'm with Firelands Regional Medical Center in Sandusky, level 3.
Sherry Kovac.
Hello, it's Sherry Kovac from the Central Ohio Trauma System.
Jennifer Snyder.
Hi, this.
Uh-oh, Jennifer, I think you got muted again.
Hi.
Can you
Can you hear
repeat?
me?
Yep, we can hear you now.
Sorry. Jenny, level 2 adult, Mercy Health St. Rita's, trauma program manager. Thank you. Sorry.
Awesome. Katie Stegman.
Hey, good morning. Oh, it's actually, yeah, good morning. Bethesda North Hospital, Cincinnati, level 3.
Robin Blacka.
Hi, this is Robin. I'm from Cleveland Clinic Akron General, and we are a level 1 adult.
Vic Graymeyer.
Good morning, Vic Graymeyer, Central Ohio Trauma System.
And Andrea Weber.
Hi, this is Andrea. I run Fisher Titus Medical Center in Norwalk. We're a level 3 verified.
Okay. All right, and I have a couple phone numbers. Just let me know if that is you, and if you haven't already introduced yourself, go ahead and do so. I have area code 330-297-4059.
Julie from UH Portage.
Okay. Area code 419-557-6843. I also have a 419-226-9150. And I think sometimes for the people
I can tell you that number is from St. Rita's because that was my old phone number. So you have St. Rita's representation.
Okay. I think on the phones, if you're just on the phone, sometimes hitting *6 might unmute you. It's a little odd sometimes with phones. There's area code 330-344-6393. And the area code 330-397-2762. Area code 330-714-1749.
That's me, Kendra Hatridge.
Okay. And 614-206-4291.
This is Tammy West, PI coordinator at Mount Carmel East.
All right, welcome, Tammy. Is there anyone else that has not introduced themselves that's on that wants to do so? All right, so we will move next to approval of minutes. The minutes are located in the attachments in the meeting, and then they were also sent out last night. Can I get a motion to approve the minutes or to reject if there's edits that need to be made?
I have motion to approve. They're good minutes.
Okay.
I can second. This is Melody.
All right, thank you. Heidi did a great job. All right, so minutes are approved. We'll move on. All right, so treasury report. I'm not sure if Kristen is on. She wasn't pulled up. She is on vacation, so unless she pops in, I will go ahead and kind of do a quick treasury report. Pull this over here. So for the month of March, our end balance is $36,725.31. Looks like there was a debit of $3,500 in February, which was the education for the board for the officers, and then the $300 charge in April, which is for the webmaster fees. But outside of that, we haven't had any new charges. I wanted to touch really quick on the paid membership. The dues were sent out, the paid dues were sent out as well yesterday with the rest of the other documents. And trying to figure out with as far as dues and just getting everything out to everyone. So we currently have 32 voting members. So of course, for those that may not know, in order to be a full member of OSTNL and to have voting privileges, you do have to be a paid member. So there is the $150 annual fee that you would fill out the a registration application and submit that to Kristen in order to become a voting member. So as of yesterday, April 1st, we had 32 voting members, which is 55% of our total pool of trauma centers across the state. So I would like to get that number up so we can have more participation as far as voting and as we go through different decision making throughout the year. It's always a hard thing at the beginning of the year and it's easy to forget about. So I just wanted to highlight that a little bit so people could be aware. The application for dues was also attached in the email yesterday. It is attached to the meeting minutes, and it is also on the OSTNL site. So I do have all of the current voting members listed up here. If you think it's an error, definitely email and let me know. But in order to get quorum, I am, especially since we do have some things to vote on today, I am going to do a quick roll call. So if I call your center, just say here or let me know that you're here. Hopefully moving forward, we won't have to duplicate this. Heidi wasn't able to join today as secretary, so she's going to do the minutes from the recording, but hopefully moving forward, she'll be able to check off quorum as we're doing the roll call. I wasn't able to do both at the same time today, so a little duplication today, but hopefully will be a little bit easier moving forward. So I have Akron Children's. I don't believe Ann is on. Atrium, I am here. Altman Hospital.
Yes.
Yes. Okay. Bethesda North.
Yeah, I'm here.
Okay. Blanchard Valley. Cincinnati Children's.
Yes.
Cleveland Clinic Fairview. Cleveland Clinic Hillcrest.
Yes.
Dayton Children's. I don't believe they're on. Grandview.
Yes.
Fort Hamilton. Soin. Oh, yeah, Soin Medical Center. Marietta Memorial.
Hey, Alex, this is Melody. You left off Kettering Medical Center. I think I was on the list of paid that you sent out yesterday.
Okay, I will add that. Sorry about that. And you are here, so I will add you in my list. Marietta Memorial.
Yes.
Yeah. Okay. Mercy Health St. Elizabeth.
Denine's on PTO today.
Okay. Mercy Health St. Joseph.
I'm here.
St. Rita's. Mercy Health St. Rita's. Metro Health Medical Center.
This is Tina. I'm on.
Okay. For Metro Health.
Yeah.
Okay. Nationwide, I believe Leanne is on leave currently. So, Ohio Health Mansfield. ProMedica Defiance.
I'm here.
ProMedica Toledo. Suma Health Akron. UH Cleveland.
I'm here.
All right. UH Elyria. All right. UH, I will not say this right. Is it Geauga?
Geauga.
Geauga.
I don't think Deanna's on the call.
UH Portage.
Julie's here.
Okay. UH Rainbow Babies and Children's. University of Cincinnati.
Yes, I'm on. It's Jenny.
University of Toledo, that's Kristen, she's not. Western Reserve.
This is Itzy, I'm here.
And COTS. I know Vic is on, so.
Vicky's here to vote and Sherry's here, but Vicky's the voting member.
Vicky's voting, okay. And then NOTS. I don't think Danielle is on, so, okay. So we have 6, 7, 8, 9, 10. We have 15 voting members, so we do have quorum.
Hey,
So-
Alex.
Yes.
This is Ann Moss, Akron
Hi, Ann.
Children's. I'm here.
All right, thank you. We have
And
16.
Kristen, I want you to look out for your mail because we sent ours in yesterday for Genesis.
Okay, perfect. All right, so as we move forward today, we'll be able to vote on items. I did have two things that I wanted to present to the group as far as voting options. We talked about different ways that we wanted to vote at the last meeting, especially with this electronic platform and how that would work. So I had two options that I wanted to present to the group. Then we can make a motion on each of these. So option one is a platform called Election Buddy. It sends out very unique de-identified links for voting. It really depends just on how secure we want our votes to be. This is going to be probably one of the highest levels of security. So I will give a quick show you really quick how this works and what it looks like. It's a really nice setup. It can be used for election voting. It can be used for nominations. It can be used for voting on bylaws and so on. So this is kind of what the platform looks like. I will show you when you first start setting up the ballot. It'll ask for voting details, so we can enter that. We can have a start and stop time on the election. The thing that I thought was interesting about this is if we decided to make this adjustment in the bylaws, it's so secure that we could essentially just send this link out just to the voting members and handle some of these things even outside of the meeting. You would put in your different organizational details. And then set up your ballot. So I just did kind of a mock ballot for the election, and I did send it out just to test it. So you can, I'll go to the ballot here so you can see what it looks like. So you have here, this is kind of what your results look like when I put through the different candidates for election and put through a couple votes. This is what this would look like when you receive the ballot. It would be sent via email. You would be able to select your candidate and then verify your selection, and it would submit the ballot. Really quick, I'm going to show you what that looks like as well on email. It allows us to send an email coming from OSTNL, so you would receive the email directly. And again, it's a unique link, so once you vote once, you can't go back in and vote again. I'm gonna pull up the email really quick so you guys can see. Oh, that's weird. It didn't, can't find that email. Well, in the interest of time, I won't search for it too long. But generally speaking, this is kind of the gist of it. And then on the back end, it does calculate your votes. You can do graphed results on it and kind of see who wins. You can do an audit. So you can see here, this is the code. So you can see that it's all anonymous. It's de-identified. The only thing that it's tracking is it has the IP address of where the vote came from. So of course, there's always upsides and downsides. So the downside with this platform is it's free to use as long as you have up to 20 voters. Well, of course, we have more than that. So from 20 to like 350 voters, it is $19 per election. So the thought would be for this would be maybe for the bigger votes that we have, like elections, like voting on bylaws, amendments, or any other significant votes that we may have. And again, this could, because it has such security, we could consider using this to vote outside of the meeting, because this has a time frame. I can set it to voting opens at 9 a.m. and it closes at 2 p.m. And it would be maybe during the duration of the meeting, but it would go to all voting members, even if they weren't present at the meeting. Again, for elections and that kind of thing. The other option is Microsoft Forms. And that is an option that, pull up the wrong one, that is built within, of course, with Microsoft Teams. So that would be essentially a free option that we could use. I plan on using Microsoft Forms for any of our smaller motions. So just to test it out, I will do a quick demo in the chat so you guys can see. Maybe not. It's not giving me my options here.
Hey, Alex, it's Ann. I found my email from yesterday on the vote. Do you want me to share it real quick?
Yeah, if you want to share it really quick, just so people can see.
So this is the election buddy. This is the example of that.
Hold on, let me close out my sharing so you can.
Sure.
Okay, and you can share.
Okay, it's spinning. Sorry. Okay, so it was very, very clear at the top up here. You can see the vote now came up first and then OSTNL. So that's what it would look like as you get it.
Yeah, it's very clear. It's of course easy to use, and it's, like I said, it's very secure. If that's something that we're really concerned about, wanting to make sure that we have secure voting, then I think this would be a good option to use. Thank you.
You're welcome.
So I'm gonna flip back to my screen here. And so with forms, it doesn't look like it's giving me the option in Teams. So I'm gonna have to play with that a little bit to see. When I did some other meetings, I was able to submit a voting button within the chat, but it's not giving me that option right now in this meeting. So I'll look into that a little bit further. But this is the other option for voting. So this is Microsoft Forms. It works a lot like SurveyMonkey. It's very, very similar. But then we can actually make our own content, and there's not a paid fee because this is all rolled up into the Microsoft package. So we create the election very similar to even with the election buddy. But the only downside with this is it would just be one single link. We could send it out to all the voting members individually. However, that is not a unique link, so it can be used multiple times. Someone could forward it to someone else and it could be used. I think for the smaller votes it's not that significant, but I just want to push that out to the group just on what your comfort level is as far as security. But we could pare it down enough to only send it out to voting members, and then using the honor system to ensure that you're only voting one time for a candidate or on a bylaw or so on and so forth. The only other way that I kind of brainstorming to give a little bit extra layer of security to ensure that we don't have duplicate voting is to assign a OSTNL member ID. So the thought process with that would be each paid member, as they pay their dues, will receive a unique number from Kristen. That would be their voting number that they would submit with their vote. Kristen would be the only one that knows the numbers and what number is tied with what facility. So then it's not that everyone knows what number is who. She would be the only one that would house that, and then as president I would oversee the voting, so even I wouldn't know whose numbers are attached to whose. So with this form I created that where we would have, for example, the election, and then you would also enter your member ID, and then once you voted, so playing with this, added a couple different votes in so you could see. This will break down your votes, and you can see on the viewing of results questions. So it would show up like this: respondent number 3, which is anonymous, so that you wouldn't see who was voting, but you would have the member ID. So as we go through the list, the votes that didn't have member IDs attached or they had invalid member IDs, we would remove those votes once we did our final calculations. So this again would be a separate link that would go out. It would go to emails, but it is not unique as far as with the election buddy. The codes would also need to change annually, of course, as new dues would come into play. So I would need, so I wanted to get a feel for that and vote on what platform the group wanted to go with. I'm a little disappointed that I can't pull up Teams in this chat or the form in this chat, because I thought we could vote via the forms in here. So,
Alex, is that $19 per person or $19 per send out of the election?
it's per send out, so it'll be for that entire election. So even if we had 5 candidates, whatever election we have or whatever we're voting on, is per session. So it would be $19 for the election and then another $19 if we wanted to do the bylaws. Unless we were doing it all at the same time, I think we could probably put all of it on one survey or one ballot. So we could essentially, if we knew, like, for instance, if we were voting like today, voting on bylaws and voting on election, I believe the way it's set up, we could put both of those things on one ballot and then just pay the $19 if we could coordinate that way.
Alex, are you going to open this up for discussion? Is that what you want right now?
Yeah, I wanted to make a motion to discuss the election buddy platform in Microsoft Forms and decide on which option the group would like to go with, and then open it up for discussion.
I'll make a motion and then people can say yay or nay. I would say make a motion to use the option 1 for the elections, and then to use the option 2 for any non-election voting type things that would be to be done. If that's said right.
I would second.
I mean, personally, I think most important is it has to be easy. And when you start getting IDs being sent out to each person responding, and that's just kind of, I think, a lot of back and forth, and it's going to get lapsed. So I would do elections, big elections, for $19. I think we could pull that out of the $36,000 and be fine. And I think any of the other things, small voting ways, which not elections, we could just send out something in the forms where it doesn't really matter on, if duplicate people. That's my opinion.
Okay. And who was it that second, just for Heidi, since she'll be listening to the recording, so she knows who's who?
Melody.
All right, thank you. All right. Anyone else have any discussion on the different options? Okay, seems like everyone is in agreement. So we'll go with unanimous unless there is anyone that is opposed. So is there anyone that is opposed to Lynn's motion of going with election buddy for the major events, major elections, and then using option 2 Microsoft Forms for the smaller decision making throughout the group?
Hey, Alex, it's Andrea. I definitely don't disagree, so don't put me down for that. I agree with everything everybody said. The thing with Teams or the forms, that would work great for things where people would like to be anonymous, but we do have the option in Outlook for voting buttons too. So if the anonymity part of it doesn't matter, we could always use that as a quick yay or nay voting option.
Okay, that's a good option. I've used that before. That's a good idea. Thank you.
Mm-hmm.
Okay. All right. Well, I don't see any opposition, so we will go ahead and move forward with Lynn's motion and move forward with Election Buddy. I will get with Kristen on setting up for payment for that. And what we'll probably do, since we do have election voting today, I will actually send that out today for voting for the president-elect. So we have everything set up already and good to go. All right, so updates. Ohio TQIP Collaborative. Ann, do you have any updates for us?
So I missed the last meeting. I was with my new grandson, so I apologize. If anybody else was at the meeting, the subcommittees are progressing. The VAP, the AKI, COVID, and isolated hip fracture. If anybody wants to weigh in on any of those subcommittees.
So I'll give a quick, I forgot that you weren't on, Ann. Just from what I recall from the meeting, we went through all the different work groups, and I'll let each person kind of go through their own section. We did talk about Ohio TQIP Center participation and did some quick calculations on that there was, I think, a handful of centers that currently weren't participating in Ohio TQIP, and kind of brainstorming a little bit on how to encourage those centers to participate in the collaborative, and try and find out what the barriers were, if there were any barriers, or if it was just an awareness issue. So I think there was going to be more to come with that piece, and I can even put that out for discussion if anyone has any comments on barriers that they face with the OTQIP Center participation and participating in the collaborative. I know for the level 1s and level 2s, there is a cost, and that was discussed as one of the potential barriers. That's just one more cost to add on to a budget that a lot of people are already fighting for. So if anyone else has anything they want to add to that piece, but if not, we can start with the work groups.
So this is Melody. I can talk a little bit about VAP. Thanks to all of you who participated in our webinar that we had in February to work on getting more cases of non-VAP and VAP added to our database. And I know that Dr. Mary Moran is working on getting those set up. And we have a meeting actually on Monday for our subcommittee to move forward with action items. Things that we've been talking about are having a tutorial video that kind of explains how to use the VAP interactive algorithm, and then kind of trying to figure out when do we have enough. I think Dr. Moran is looking at making sure that the tool is valid and reliable, and then when can we roll it out. So more about that later. And if I missed something, yeah, I'm actually looking at Mary's email and trying to pull a summary out of that.
No, it sounds like you covered everything. Thanks, Melody.
The AKI subgroup, I'm not sure who was heading that up. And I don't know if they're on.
Hi, this is Judy Keefe. So we I'm part of the committee, but then we picked a couple of us to get together and kind of look at an algorithm for AKI that we could use. And so that was Andy Duplain and Robin Black and myself. And we worked on that. We worked on the definition so that everybody could understand the same, we all had the same meaning for the definition. And we presented kind of what we did to the Ohio TQIP, and then we're going to go on and do our algorithm a little bit more in detail and then give that to the committee. So that's kind of where we're at right now as far as the AKI. Robin, I don't know if Andy's on this call, but Robin, did I miss anything?
No, that pretty much summed it up. We're just kind of like still in the beginning stages. We got input from everyone working on just the different variations in the interpretation of the definition. So I think we're planning to meet again in the next couple weeks.
Yeah, I have a doodle poll. I was waiting for a few more people to respond before I set up the meeting. So okay, should be getting a meeting request soon.
And I can give a quick update on the COVID work group. And actually, the plan was to talk a little bit about this later, so I'll just throw it out there now. So as I mentioned, the last meeting, the COVID subcommittee, we put out the survey a year ago. We did the poster presentation on it at the last TQIP meeting. So now we're at a space where we're just wanting to do a 1-year recap and just really see where all the centers are at as far as COVID and as far as the implications that it's had on our trauma programs and our trauma centers. So we put together a second survey that is a much shorter survey. There's not as much data. A lot of it is just, are you continuing to do X, Y, and Z, or have you stopped? And where do you stand right now? So we're doing it a little bit different because there was some duplication in the survey responses with the initial survey. So this survey will be sent out from the region. So if you are participating or affiliated with a region, you will actually be receiving this survey from your regional coordinator or regional representative. For the facilities that do not participate in the region, you will be receiving that email from me. Myself and Mary Moran, we will be tabulating those centers that are not affiliated with the region. So it will be a paper survey, which of course is not always ideal, but again, it is a lot shorter. So the plan will be your regional representative will send out the survey, you will receive it and then send it back to the regional representative. Then they will hand put in your responses into the electronic platform and ensure that we don't have any duplication. The biggest thing with that, as far as duplication goes, is we do want to try and put together either another poster presentation or even a manuscript by the end of this year. And so, of course, we want to have as clean of data as we can. So you'll get some of that communication. The plan is to send the emails out Monday. So I believe that is April 5th. You should start seeing the emails, and the survey deadline would be, I believe, April 15th. We are going to go up to April 15th to submit that survey. So that's all I have for the COVID group. So if anyone's from Isolated Hip, I think, Julie, I think you're on heading that up. Is that?
Yes. We are at the tail end of finalizing, combining the different TQIP practice guidelines. We're trying to come up with one master guideline, and then Mary has helped us develop a tool, gap analysis tool for different centers to be able to use compared to what the ACS outlines as best practice to see where they are. So I am past due at scheduling another meeting for us to do our final blow through, and we're very close to being at the end.
Right. Thank you. Anything else for Ohio TQIP?
I don't think so.
All right, thank you. All right, Department of Public Safety. I'm not sure if Eric is on. So any updates from Department of Public Safety? Yeah, I don't think he's on. All right, so liaison reports.
Alex, this is Diane. I can give one little update from ODPS. They are in the process of filling a lot of positions. Eric's department was down 50% because he had a couple retirements and things like that. So they are filling those right now. But the one thing they have filled, Rob is now the director. He was the interim director. Rob Wagner is now the director. And they have filled the deputy director for trauma. And his name is Aaron Jennings. That name may be familiar to a lot of you. He's been in EMS. He's been in trauma for a long time. So I haven't got to meet him in our professional standard yet. So I'm looking forward to that in May. Just wanted to let you know that someone has filled that spot. Rob will continue to work with us, I'm sure, because it's kind of where his heart is. But as time constraints cause a problem, I think Aaron will be really, really good for us.
Great, thank you. All right, and you can go ahead and do state trauma committee if you'd like. So the next 3.
Well, Julie attended her first meeting and lived to tell about it. So, Julie, do you want to report or you want me to?
You could go ahead, Diane.
Okay. All right. So we met in March. We did have quorum. We are working on, there's a couple things that are kind of pending right now. The biggest thing we're working on is the work groups that we've created for education, for trauma education. And this is looking at education between physicians, nurses, and EMS. We're looking to see where the gaps are in the state. We know there are gaps, and then we're going to try to kind of brainstorm and see where the best and most logistical way to kind of cover some of those gaps are. We are not looking to increase anyone's workload because right now everybody is working extra hard on other things they usually don't work on in their lives. So, but that is not our goal at all. Our goal is to see is what kind of resources can we give them, can we offer people so they have it. So that's our big thing we have going right now. We will be getting data. I think the deadline for 2020 was at this as a couple days ago. So hopefully we start getting 2020 data in because we really want to push out another annual report. We think those are very important to get out. Of course, this year we've been kind of hiccuped by the fact that we kind of had to extend things for people because registries were behind, understandably. So we're going to wait on that, and hopefully we'll have an update on that annual report with the next meeting. So that's about it.
And then MFATS board. Oh, Stacy is on, so I don't know if Diane, if you want to take on that one too.
Oh, okay. Stacy's not on today. Okay.
I don't think so.
Okay. They met in February. They'll meet again in a couple weeks. They had their board retreat in February. Their biggest problem was, first of all, getting board members approved. They had the chair was not approved. I mean, they had the turnaround to get the approval of these positions it's really difficult. So they finally got everybody kind of set, I think. They still have some openings on the board, but it's pretty well set. The biggest piece of legislation that came through that kind of is the topic of conversation with this group is the governor has signed a bill that will lessen the ability for, it would actually increase the ability for people who have a felony record to become an EMS provider. Before, it was very strict. If you had a felony conviction, you could not serve the public in that manner. But the governor has lightened that so that certain felony convictions are now allowed to work within the world of EMS. So that's kind of concerning to a lot of people. And they're kind of working through, okay, how do we monitor this and make sure there are not problems? So.
Thank you. OIPP, Barb, is there anything new from OIPP? Barb, I think you're muted.
Sorry, I opened my camera and forgot the microphone. They did have quite a lot of information that came out from the February meeting. I don't know if that information got sent out to everybody or not. But they had big presentations on the drug overdoses, mortality, different things with COVID that they went through. So if that information didn't get sent out, I thought I'd send it out to you right after they sent it to me in February. But if not, I can send it back to you so everybody can read it, because it would take a long time to summarize.
Okay. Yeah, I'll look through, and if not, I'll send it back out.
Okay.
I don't think Shannon is on for STN. If not, does anyone else have anything about STN that they wants to chime in on any updates. And Tina had to step off, but she said there's no updates, unfortunately, from OCOT. So Lynn, anything with PTS?
No, no report, nothing.
And I don't believe Danielle is on either. But she did send me for ORTOC, but she did send me meeting minutes, so I will send that out as along with the OIPP information. Does anyone have anything that attended the meeting that they want to throw out there as far as any updates? Okay. And lastly, for AOTR, the only update I received, there's not a ton going on, but the education chair did send out a survey, a needs assessment survey for 2021 for AOTR, and they will be holding one Ohio Trauma Registry course this year, and they're planning on doing it virtual again. But that was the only update I have from them. All right, so moving along to subcommittee reports. Carly, education.
Yeah, hello everyone. So for education, we've had a couple meetings in the past month. So first things on the agenda is our next session in May. We're going to do a panel discussion on virtual site visits. So if you are interested in being or willing to be on that panel, please email me. And then if there are specific questions anybody wants, email me those as well so I could give the panel members those in advance so they can maybe prepare some of their responses. But that's what we're going to be slating on our May education session to do. And then after that, Alex is going to be sending out today a education survey for trauma narrator for an electronical trauma flow sheet documentation. So it's just kind of a needs assessment. Do you have it? Is it something you're going towards? Do you want to know more about it? And then specifics on what do you want to know about it? Once we go over that, we're going to break that education out into sessions, kind of like we did the drill down. So everybody can we can go through each step of that process for everyone. And then once the standards book is out, we will be doing chapter reviews of that as well. The May is the first, let me pull up my calendar so I can give you the specific date. I believe it's that first Friday, the 7th. So it's May 7th at 9 a.m. is the education session for the May. Awesome. Well, if you guys have any other ideas you'd like for the year, please email me. We're still looking if anybody wants to be on our education subcommittee. Feel free, just email me any thoughts on things, and please take that survey once you get it so we can kind of gauge what everybody wants to hear. Thanks.
Thank you. So that trauma area survey did come out, and some of you have filled it out, but since there was some people that weren't on that invite, and just to refresh for those that might not have seen it, I will be sending that out again today. So level 3 group.
Hey, this is Diane. We met just prior, had a great meeting with good participation. We are going to pilot the NEFTI criteria. So we're figuring out the logistics of how that's going to be done, how we're going to get our data. Olivia Hauk has agreed to be our math guru for that. So she's going to do all our calculations and everything for us. We just have to submit data. So we're going to do that. And then we spent a good deal of the meeting kind of picking Shannon's brain for virtual visits since she just had her level 3 verification visits. So that was good too.
All right. Anything for PI, Anne?
So we're having our first meeting of the year after this meeting, and we had debated with Eric Mays whether to even meet because of his staffing levels being what they are, that, you know, they're not able to run any reports and so forth. But I talked to Richard George, and we thought that we could just kind of get together and talk about what are our expectations for the rest of the year, kind of brainstorm about some goals, look at a timeline for the annual report, and do we need to tweak anything with the annual report? We both thought that there were some recommendations for the next annual report, but we couldn't remember what they were. But anyway, just kind of, talk about that, any tweaks that we have for the annual report coming up. So it'll just be kind of a planning session. And then our next meeting after that will be in June. And hopefully he'll be better staffed at that time so we could move forward.
Okay, awesome. Andrea, anything update-wise with the website?
Really nothing too new with the website. We got our quarterly invoice, so I know that went to Kristen to be paid, and I know we're trying to figure out the Teams situation, if that's something that we'll be able to purchase. And I know AOTR has been looking at that option as well. I didn't know if you wanted to talk about that anymore at all, Alex, or kind of wait on that.
I have it later on, but we're close to it anyway, so I can just throw that out there as an update. So we did get some final pricing on the Microsoft Teams platform. It's going to be about $300, which is cheaper than what we initially kind of projected at around $450. And that will be for, I believe, 4 email or 4 accounts that we would have. We'll be able to send the meetings out to everyone, but there will actually be specific accounts that would be tied to this platform. And then, so we'll be making kind of a generic email account. So then once we get this set up, instead of the emails coming from my work email address, it will come from president@ostnl.com or .org. So then everyone knows that it's coming from that individual. And then what we've decided is that the president-elect and the immediate past president will also use the same email so for some reason they need to send something out on my behalf, it's still all coming out of that same email. There will also be an email for the education chair. So it will be education@ostnl.com or .org. So then anything education update wise, you'll see it come through that email. One for secretary, and I believe one for treasurer as well. So again, $300 annually for that, and then we'll have our own platform. So as roles change, we'll be able to keep that same meeting and not have to change platforms and so on. The other piece with that is we are pairing with AOTR, so they'll be sharing. They'll have their own email addresses, but they'll probably they're kind of deciding today officially where they want to go. But what will likely happen is we will be kind of overseeing and the initial partner with the Microsoft Teams, and then we'll just invoice them for their portion. So they can invoice for their own platform and go from there. I think that is it. Did I miss anything, Andrea?
No, I don't think so.
All right. So new business, I wanted to just throw out there, there was an update that was sent out for, and now my email is just freezing and I can't get to it. But if anyone has that or wants to throw that out there, but the UIN number that we've been discussing about pretty much since the new NTDS dictionary came out, the ACS has put out a statement that is now on hold until the platform is ready. So pretty much what we were already kind of saying on our end, that there wasn't really a functionality in place for this to actually move forward. They've got wind of that, and they did put out a statement that is something that's not going to go away, but they do understand that is not something that all centers will be able to provide until that functionality is in place. I believe that update came from I believe the college. Like I said, I can't my email is just not cooperating today. So I don't know if anyone knows for sure where that email came from or if you guys received it as well. Right, so next I would like to cut to Shannon and whoever else has had a virtual visit in the last couple months, or really since the virtual visits have started, and give us just a quick overview and some feedback. And if anyone has any questions, like we said earlier, there's many centers that are either verifying or going through provisional or consultative visits over the next couple months. And this virtual platform has been kind of new and crazy for everyone involved. So I wanted to take a chunk of time just to talk through the virtual visit and share some lessons learned and share ideas for those centers that are working on visits currently and for those that have just had them. So Shannon, I guess you can start because I know you've already had some conversations, and then anyone else can kind of chime in as we go along.
Okay, thank you. Yes, we did have March 11th and 12th was our big day. It was my very first re-verification. And so, and of course, the data year, we had been postponed the day before our re-verification last year. And so they were gracious enough to let us use our 2019 charts. But of course, that was the very first year that my full year as a TPM. So looking back on those charts was a bit painful. However, I was able to show data from 2020 as well. They let me do that. And so what I did is in the loop closure form that we created to share with them, not only did we put the loop closure in each chart, but in the PI section, when the ACS sent out, how they wanted our charts and, what sections and whatever, there was a section that they wanted filled out with PI. I had put every issue that we had ever worked on or had been working on, and then made a loop closure form about when did we notice it, when it started, and I can actually share that, and I'm going to send those forms out to you so Alex can distribute it to the group. But let me share this real quick so you can see. Alex, can you see that? It says loop closure.
Yep.
Okay.
It's on. Yep.
So in that section of, we uploaded our charts to Microsoft Teams, and in OneNote, put it this way, we did in OneNote, and then we uploaded OneNote into Microsoft Teams, created a new channel in Teams, and then the only people that had access to that channel was the program staff and the 2 reviewers. And so we sent that, and I can pull that up too. This is what the OneNote for the PI section looked like in Teams. So we did our PI plan. This is where we put our FAST exam review. All the peer minutes were grouped together, and trauma committee minutes were here. But with this loop closure form, my TMD had said, we need to make this as easy as possible for the reviewers. So I didn't want them to have to think, oh, what was that PI issue again? And when did they close it? And then in another chart, and then say, wait a minute, didn't we just have that PI issue? I didn't want them to have to jump back and forth. So that was the reasoning behind adding this loop closure tab within Teams. To kind of tell on ourselves.
The OneNote isn't showing. It's just showing the Word document.
Oh, let me try this again. I apologize.
No problem. It may be if you're sharing the screen versus sharing the document, sometimes that messes me up.
How about that?
Yep, perfect.
All right, so this was the PI tab, and then we created for the different documents a notebook for every document. And then within the notebook, here's the loop closure notebook, and then our issues here. And then that was where I uploaded the PI form so that they could see where we were, what we did about it. And added, like in some of these, I had the 2020 data as well, so that they could see what we did in 2020 to be able to definitively close the loop. The other thing I didn't say in the level 3 meeting was that when we created our Teams meeting, we only did one invitation for the whole day, but the coordinator, I made sure that she was very specific with physicians and with guests about what time they were supposed to jump on, because we didn't want the reviewers, oh, we've got from 8 to 11, we have chart review, so that's this invitation. And then they had to get out and go into another invitation. We didn't want them to have to worry about doing that. We just wanted one link, and they appreciated that as well. Does anybody have any questions for me?
Hi, Shannon. This is Sherry Nuski from Altman. I've already talked to you a couple of times, and I greatly appreciate your help. It's been fabulous. Regarding meeting request, how far in advance did you send out meeting requests to them?
A week.
You sent it just a week ahead of time?
Yes, we did a trial run 2 weeks before with a meeting request, and then so the Friday before our Thursday reverification, we made a 10-minute meeting with all participants to jump on for 10 minutes so that we could make sure that their bandwidth worked, that their video worked. A couple of the docs didn't have cameras for their computers, and so our IT guy loaned out cameras for their and actually set it up for them. So we had a run through the week before, and then that right after we did our run through, we sent out the real invitation for the following week.
Okay, gotcha. Thank you.
You're welcome. And then we had, oh, I'm sorry, go ahead.
I was just going to say the agenda that they send out for the visits, this is Itzy from Western Reserve, are very much laid out timeline wise what they want you to do and who they want you to include. So, I mean, that does take away a lot of that guessing of when you should send the stuff out. Like, it definitely does tell you that. And we use Zoom as our platform, and we sent out one. You can go into Zoom and add different, like for our physician meeting, we stayed on everybody, like the surveyors and I stayed on the exact same link all day. We never got off the call, but people could click on the link and come in and out of the meeting as needed. So we were able to utilize that with Zoom as well, and the breakout rooms.
Nice. Good, I'm glad that went well for you too. We couldn't use Team, our legal department wouldn't let us use Teams because of some of the issues they had with security for Zoom, so we were only allowed to use Teams. The other thing that they did appreciate was on our second day when we did the tour, we used a computer on wheels. And again, our IT guy came through in a big way and got us one of those, where the documentation stations that most nursing and places use anymore. We had a computer on wheels that they mounted a camera on. And so it made it really smooth pushing it through the hallway instead of, having a phone or an iPad that someone was carrying. And it just was a lot smoother and didn't bounce around and whatever, so.
Thank you, Shannon. Is there anyone else that has had a visit that wants to throw in anything or preparing for a visit and has some feedback that they want to give out to the group?
I can say, and I said this in the level 3 meeting, we did use an iPad, and we bought a rolling stand off of Amazon for ours for like $100. And it worked very well. Like, it worked, it rolls nicely. It doesn't move at all. You tighten it and the iPad just stays there. So that was really helpful for us for what we needed.
We also bought a wireless microphone because of people wearing masks. It was so difficult to hear. And so we got a wireless mic to mount with that camera as well.
Hi, this is Christy from Fort. I always just had a quick question about some of the other things you had to download ahead of time. I know you had the 25 charts, but did they require anything like your operation meeting minutes ahead of time, or disaster preparedness stuff, injury prevention, those kind of things? Did you all have that laid out ready to go, or did they view that when you're on your first day?
It was all out ahead of time.
Okay. Thank you.
You're welcome. And I will tell you, it took my PI coordinator and our APPs working together a solid 3 weeks to upload all that. And I mean, some days we work sun up to sundown, you know, trying to get that right, getting documents straight, because if you would, you know, we would download it from Epic and upload it as a PDF into a shared drive and then download it into OneNote, and you know what I mean? And so sometimes though, if you would scan it in, the print, you know, to upload it into your email would scan sideways. And, you know, our my TMD looked at that and said, oh no, you can't send that to the reviewer sideways. We want to make this easy. And so sometimes that would entail having to screenshot it and then turn it the, you know, the right way and crop it and all that mess. But every single piece was sent to them 7 days ahead of time. So they had that full week to look at every document.
Hi, it's Jenny Brodsky. I'm in the process of doing it. I discussed this a little bit at the level 3 right now. I will tell you the time is unbelievable that this takes. And one thing that has helped me is the Adobe Pro, which I had to put an IS&T request and pay for, which is helpful. Easier to help me put the documents together and also rotating the documents. Maybe you guys already had that, but that has been helpful for me, but it's extremely labor intensive.
This is Jenny Lemick. I will tag on with Jenny Brodsky because Jenny's review is 2 weeks after my review. And yes, the Adobe Pro was extremely helpful since they want things in PDF to be able to do that. We also have a snipping tool. The whole screenshotting thing, I have done that in the past for other things that never would have worked for us. The amount of time just to upload things, and it's just really kind of unbelievable. I've worked on the documents, and you have these wonderful documents in your PDF and you get down to about page 8 and all of a sudden, oh shoot, now I've got one facing the wrong direction, and you know, you don't want the reviewers having to look at it sideways. And so just getting it to look right in there was a big challenge. So we started out by all of us getting OneNote. Not only did I get it on my computer here at work, I also have a work laptop. So I had to remember to ask for that separately and have that put on. As Jenny mentioned, getting the Adobe Pro, which is not something that everyone has because you do have to pay extra for that. And just, you know, playing with these and learning all these new programs has just taken a huge, huge amount of time. So I think we spent more time preparing here than just making it look pretty than we actually have even looking at any of these charts, of which some of them are 2 weeks old. So hoping to have some time to do that next week and the following week, and then we have our review. So the preparation is a lot more work than we thought. We knew it was going to be a lot, but it's even more than we thought.
And this is Itzy again from Western Reserve. I suggest we reached out to our surveyors. Luckily, we were fortunate enough to get this. Our lead surveyor was the same one that we were initially going to have when we got canceled. And we did not use OneNote because he did not know how to use OneNote and didn't want us to. So that threw a wrench in our entire plan. So my suggestion is definitely reach out early and see what they're comfortable with and not comfortable with, because we were going to use OneNote and like had it all set up, and we didn't use it. So definitely looking out and finding out what they want and what they're comfortable with. So my guy was old school. I sent him a secure thumb drive. That is what he wanted. He was thrilled with it. So it just worked out well for us that way.
The other thing I will caution people is the ACS is not as helpful as they can be, but when they sent us our reviewers and our admin, the admin for one of my reviewers was actually incorrect. And all we got was an email address, and from that email address, you can't always tell people's names. So I was a little frustrated that, like, within the first 24 hours, you know, our admin had reached out only to discover that we didn't even have the right name of the admin for the reviewer. So yeah, just having people to be able to help you out with things like that.
One other thing I found challenging, it might be just because I'm kind of a one-man show with a little bit of help. It's not easy just to pass off all your work to other people because you kind of know where your program is. And so unless those people have kind of been looped in from the beginning, it's a little hard just to pass over stuff. You have to still make sure that everything's right and the way you would want it to be. I'm thinking Jenny might have the same issue.
Yeah, right there with you, Jen.
No, I mean, I had to use a stroke coordinator as a navigator. I mean, my stroke coordinator luckily had been an ER nurse here within the last 6 months, and she was one of my navigators. So it's, when you're small, it's challenging to even find people to fill the roles. And I definitely let my surveyors know that up front from being a small facility that, like, my trauma department's me, a registrar, my medical director, and I said, these are the people that I'm utilizing. I kind of vetted them through them, and they, my lead reviewer was like, that's perfect. So.
Yeah, same. I had to, I mean, even though our program itself is small, I had to pay for, other service. I had to lease employees in order to do that for us. And luckily we have trauma APPs that I could do that with, but, had we not had them or had their boss not allowed them to do that for me, we would have been in a real pickle.
I think this is some of the information that we give back if we get a chance to ask back to the VRC or whoever, the Committee on Trauma or whoever, to say, like, unless we just all get a lot better at it and we set up our programs differently in the future, like, how we do stuff. This is really, go ahead.
I'm sorry. So with that navigator role, so are the reviewers actually asking them questions, or are they just simply there to navigate through all the charts and everything like that? How are they utilized with your facility?
They tell you that all they're there to do is to navigate, but when they learned that ours were our own trauma APPs, they actually did ask some questions. And I mean, they weren't anything that was, put them on the spot or made it sound egregious. However, Dr. Chow was telling my people, look, if they ask you questions you don't feel comfortable asking, definitely turf it to us. But luckily, our APPs worked so closely with us that they were able to answer. So the directions that we were given by the ACS said that they were only to navigate, but they didn't stray from that a little bit.
Yeah, correct. My surveyor definitely told me that he would ask them questions. Yeah. So anybody say they don't know the answer, tell them to not, tell them to say they don't know the answer, but he told me up front he would ask my navigators questions.
I would say I used my trauma APP the last time as a navigator, just in the old way, and that was incredibly helpful, that they really knew the program.
Now, Itzy, were the trauma program managers allowed to be sitting in the same room with the navigators when all that was going on?
Yes.
Yeah, we did a same room, yeah.
Okay.
So, and it was, being small, it was challenging because both surveyors at multiple times wanted to speak to specifically me. So they would and they were very helpful, and they would be like, well, we'll move on and come back to that when she, knowing that I was talking to the other reviewer. So they were really helpful in that regard. But I mean, it's an exhausting, that chart review doesn't take as long as they said it would, by no means. Like we altered our agenda even from what the college sent out, because our surveyor said, this is never going to take that long. It's 20 charts, 10 each. I think we did ours in an hour and a half to 2 hours. But I mean, it was a lot of going back and forth.
Same. Yeah, it's about 2 hours for us too.
I I guess I'm kind of fortunate because I'll be with one reviewer and my trauma medical director will be with another one. So hopefully that'll.
And that's how but they might not want to ask him a question. They might want to ask you a question. So just because you're each going to be with the surveyor doesn't mean that that's who you're going to be with.
Oh, okay.
I ran back and forth multiple times.
Okay.
That's how I was, the same as Shannon here. I was going back and forth, like, so it was not just, my medical director with this person and me with this. Because I feel like, they wanted a lot of information from me instead of him.
Because you know more.
Yes, same.
True. I wasn't going to say that, but they do want a lot of information from us because a lot of questions are PI driven and they want to know, it starts with you and they want to know that. So, I mean, I feel they had more questions for me than him for sure. So it's a lot of you going back and forth. It's exhausting for you.
So Charmel, this is Christy again from Fort. Mine's not coming up till next year, but we're getting started. So as far as the room, I know Shannon said she had multiple rooms. I mean, were you okay with the one room? Do you think it worked well with you? We're a level 3, we're pretty small. What's your thought on that?
I mean, it worked well. I will say my medical director was not here. He had, sadly enough, just had his ACL repaired. So he was not in-house with us. Okay. But my navigators and myself were in a room together and it worked out well. You just have to have the separation as much as you possibly can. You don't know me, but the people that in Norton know me, I'm loud. So
me too.
That's challenging in that regard, but separation is the best thing that you could have. We were limited, sadly, for what spaces we could utilize due to COVID vaccines, clinics, and at our hospital. And we also had, we have residents at my hospital. So we had an internal medicine resident review that day also. So space was very limited for us, but we just separated, used headsets and just made it work. And they were fine with it. And we were honest with them. I said, we're going to be in the same room. We're tiny. If you want to both speak to both of me, this is how it's going to have to function. And they were like, all right, no big deal. So.
Oh, good. Okay. Did you?
Yeah, we were actually in the same, we had a conference room that has soft walls. So we, did the soft walls only about halfway. So our 2 loud APPs were in either corner. And then my TMD and I were in the middle, but within sight lines of both APPs.
Yeah, and that's kind of how we were. The one thing you did that I'm kicking myself for was putting it up on the screens. Like, that's awesome. Like projecting what each navigator is looking at, because that would have been really helpful to see. So that's a great suggestion that you had that I'm kicking myself for not thinking of.
Well, and I'll be honest, because we were popped up and running from, one corner to the other, I'm not sure how much we used that, and then we did have all of our charts, paper charts in front of us. So as soon as we heard, oh, so-and-so's working on this patient, I was able to grab that, the overview of the chart so that I could remind myself, now who was this one and what section did it belong to? And then if I would have been thinking ahead of time, I would have made 2 copies because my TMD would snag it out of my hand and then I didn't have a copy.
Yeah, we definitely did the paper charts still for each, and it was very, very, very helpful to have those. And I gave them even to my navigators because, like I said, they don't work they knew nothing about the patient. So at least they kind of took them and read them prior to it so they knew a little bit more about them.
Okay, so we'll, like Carly mentioned, we will do kind of a deeper dive into some of the virtual sessions and have a panel during our education session in May. So if you guys think of any questions in the meantime, is anyone on the call going before our May visit? I know Jenny, I know you are. I just thought about that.
Yeah, I'd be happy to talk about it too, because we're such a huge institution. And they said, oh, the trauma medical director and the trauma program manager have to be, in offices next to one another. Well, my trauma medical director is literally an entire building across the way in her office, and I'm here in mine. So we are going to try putting people in rooms and doing 2 rooms next to one another downstairs, so I can give some people some feedback on how we did that. We have set up an incident command closer back towards the holidays where we had used Teams and done something like that. So we think we can make it work that way, but I can let everyone know kind of what the pitfalls are of trying to do it that way. We're all going to have our own headsets. We all are going to have computers down there loaded with everything. So, but yeah, there was no way we were going to be able to each stay in our own offices because Amy and I weren't going to be able to talk to one another. Like, we're way too far apart, and that's just the constraints of where we are.
Yeah, my medical director and I literally were on the phone with pretty much each other all day, like keeping our line of communication open, muted, so that like when we weren't, you know, especially through that medical record review, that him and I could talk or, you know, back and forth about what they were talking about, since him and I couldn't be, you know, obviously with his situation, he wasn't able to come into the hospital. So we did what we had to do.
Melody said take pictures, which I think is a great idea, so we can see a visual setup. All right, so we'll definitely have plenty to, I think, talk about at that May session. Thank you so much, Shannon and Itzy and everyone that's contributed. So just to, before we wrap up, I did want to put out there, since we have the voting, I will be putting together that election buddy, and I will be sending that out. Thoughts on time frame for voting? Do you guys, it can be set for an hour or it can be set for multiple days. It'll be going out to all of the 32 voting members. Does anyone have thoughts on time frame for the election to be open?
I would say at least a week or two. Are you talking about the president-elect voting, Alex?
Yes, the president-elect voting.
I would say if it's going out right now, you have to be careful. People are on vacation a little bit with the holiday, with Easter, so you don't want to just have it a day or two. So
Okay.
I would have it at least 1 or 2 weeks at this time, but that's just my idea.
No, I'm good with that. I was thinking kind of on the longer end. And so we have Melody Campbell, Bernie, Jen Snyder, and Ann Monig as nominees for president-elect. So we have 4 people to pick from, which is awesome. I'm excited about that. So I will send that out today. You should get the email. When I sent the email out, when I did the test, it did go to my clutter. So just kind of keep an eye out if you haven't seen it over the next couple of days. Check those folders. It will say, just like Ann showed, Vote Now from Ohio Society of Trauma Nurse Leaders. The last thing I wanted to put out there was the bylaws. So in the last meeting, we did go through bylaws and make a couple suggested changes. I did add those in, but I did take the opportunity to look into, per the bylaws we have, that the meeting is governed by the Roberts Law of Order and rules of order. So I looked into that, into how online meetings should be structured and organized. And so I did add a large section on virtual meetings. So I did want to put forward a motion for review on this section and approval, so then we could potentially approve these bylaws at the next meeting. So just really quick, I'm just going to go through the changes that I've added so people can read through them. So it did change. It has membership in the corporation. I did change it to organization, just by definition. Organization fit better. There was discussion about adding quality and performance improvement to the membership. So how this was added, I did add this section as far as membership, but then the section below it, I think, would still stand that even though the institution has more than one member, only one would be the voting member. So the institutions that do have PI and their trauma program manager within the institution, they would have to decide who was their voting member. Then added the education chair to the officers' roles, and the education chair will be voted in the even year meetings. Or I'm sorry, the odd year meetings. Oh, look at that, didn't look right. The odd year meetings. In the formatting, I'll kind of fix, the formatting got funky as the edits were being put in. So then here is the section about meetings held electronically. So I'll give you guys a second. Let me see if there's anything else major. Just change the her to there on here. I don't think there was any other changes. Oh, I'll get to that. That's tied in with the virtual meetings as well. So I'm just going to zoom in a little bit more so you guys can read through this and see if there's any, what you think about it, if there's any suggested changes. Some of this was pulled from what the Robert's Rule of Order suggested for bylaws for virtual meetings. And then I kind of tweaked it to fit our group. But it does address virtual voting and quorum and roll call. So I thought it might be helpful to actually add that to the bylaws. So moving forward, we would have something to fall back on. And Ann mentioned that if we do get the PI coordinators on, potentially switching the representative or member at large to a PI coordinator to sit on the board. Yeah, I think that would be nice. Any thoughts so far? I don't know if anyone still needs more time to look through that section. So largely with voting, it has, it would be an anonymous voting feature unless we determine something different by our board. And then we could either do audible roll call, electronic roll call, or unanimous consent for voting during the virtual meetings, which is similar to what we've been doing. The next section, so wording, we use organization above, but okay, changing that society. I do remember seeing that. There we go. Okay. Then here's the second section. It's more of the electronic, and then there's a section about meetings held in person. I really wanted to closely look on this section because it seems like, especially since we don't have a set place with the Department of Public Safety, that was already, they were kind of phasing us out since we weren't a state group before COVID. And now with COVID, it doesn't seem like Department of Public Safety may be an option once we do decide to start having in-person meetings. So this was put in just to really, the in-person meetings may be the default and the electronic meetings will be the standard. So if we do want to hold an in-person meeting, it would just be something put out to the board and approved by the board, and then everyone will know ahead of time once we do decide to hold an in-person meeting. So just wording on that, seeing if that sounds right. And then the other section also talks about motions, that you can do motions in the chat or you can do motions orally. It does talk about doing polls in the chat, which that's what I was wanting to do with that Microsoft Forms, which the option's not showing up. So I'll have to talk to Jason with the web design and see if he has any ideas on how to get that to show up. I think it has something to do with out of system participants. Lynn, where is that typo?
It's up a little bit. It said electronic was the sentence. It's or the right here. Electronic meetings will be recorded for right there. Taken.
Okay. Gotcha. Thank you. Okay. Then let's see, made that edit. We did add a section for secretary role, just that the secretary would maintain and schedule the meetings through the internet service platform, and that they would send out an email a week before the meeting. Since we have it set as a recurring meeting, it would probably just be a reminder email, hopefully with the agenda and documentation for the meeting. Give just a quick second, people to look through that. And then added the education chair. I put 2 options, but I wanted to open it up to the group if anyone had any suggestions of other duties for education chair. And then wording on this, if you guys have a better wording. I don't really love the wording on that, but I couldn't think of anything.
You could say something, Alex, if you wanted to say like assess educational needs on a yearly basis or something like that, if you wanted to, you know, just the needs.
I guess I could just say annually. Okay, and then we added, there was a suggestion to add or top representation to the member at large role. I'm thinking, Lynn, if we would wait to make an edit until we get the PI group going, do you think that?
Yeah, I think that was just kind of a future idea, because when we initially did the member at large, we put it in because we needed an odd number, but there never has been a whole lot to do within that role. So I think it would be better, but I think you need to have the PI coordinator group a little bit more formed, and I would love to see them and then have some leadership and something on the board would be great, but I think we're too early for it yet.
Yeah, I agree. Okay, perfect. The last thing I have on here is it was a little bit confusing to me, so I wanted to bring this to the group, and maybe you guys have a better interpretation, or if we need clarification in this. So we have that the bylaws may be amended at any regular meeting of OSTNL by a 2/3 vote. However, we have for quorum, we only have it at 1/4. So it was a little conflicting to me that we would meet quorum at 1/4, but we needed a 2/3 vote to vote on the bylaws. But there wasn't clarification if this meant 2/3 of the group that was there in the meeting, or if that was 2/3 of the voting members. So
Alex, I can answer this one. This is a legal thing that they had to put that in by the lawyer when we set up with incorporation.
Okay.
So basically, it is the 2/3 of the people who can vote. It just has to be a higher level than quorum than 50%. So that's what the lawyer said had to be for this incorporation thing.
Okay, so could we put of the voting members? Yeah,
that would be fine, but
okay.
that was legal.
Okay. have this in for right now. And then so just with this documentation, since we're discussing it now, do we want to keep this as, is that part of the legal piece too, that it has to be discussed at the first meeting and actually voted on the second? Or with this new platform, do we have any leeway of being able to vote on the bylaws with that election platform?
I think we could definitely do it on the election platform, go that route.
Okay.
I think that's how we just did it initially because of the situation.
Okay, so that maybe I can add something about that. It's been documented at the meeting and then voted on, something to the effect of I'll just put add. An option. What I'll do with the bylaws, you can add documents to the election buddy too. That's another nice feature. So what will happen is I will put the edits in on the bylaws, make the voting list for the president-elect candidates, and then have a voting for the bylaws and attach the bylaws so you can review it in its entirety. And then I'll send that out and we will have that good to go before our next meeting. So lastly, all I have.
Alex.
Yep.
Sorry. So Carly had some good suggestions for the bylaws, just some wording things, just so you see it for later.
Okay.
And then okay. And then I had a question, because it looked like there was a few people earlier who had stated they've either just sent their checks in or they were going to, or wanted to double check. So if the survey goes out today, what about those folks who are kind of in the middle? Maybe they have just sent their dues in to be a voting member. How can that work for them?
Let's see. We could potentially postpone a week or two, just for Kristen to get those in. I know she said she had her staff check yesterday to see if any checks had come in. So I'll leave that to the group if we want to give it a week before sending out the voting. Either way, we have 2 months before the next meeting, so we would be getting this done earlier than our normal process anyway. So I'm open to what the group thoughts are.
Alex, in the future.
Sorry.
No, go ahead. No, this is not like, this is something, just as an FYI, for future years, it probably would be better if we cycle this 2 years not into the voting time. Like if we put it in a July thing when all the votes are in, so that doesn't happen anymore.
Yeah.
And like in the January when all the new people are paying their dues and we're doing so
here's a thought just with that. Technically, this vote was supposed to happen in December, but because of everything happening, it got pushed back and we didn't have nominees. And so that was part of why it's happening right now. Do we opt to just use the 2020 and 2021 voting members, and I'll send that out to them instead of waiting a week? I guess that would be the two options, to use the 2020 and 2021 voting members to send out for the election, or pushing it out a week or two to allow the 2020, some of the more recent 2021 checks to come in. Marianne had put that she votes to hold off elections until April 15th to allow checks to come in. Carly agrees. Lynn she agrees with 2020 and 2021. And we can do both. I can wait till April 15th and then pull in 2020 and 2021 and send it out April 15th.
This is Sandy. I agree, but I think we have to come to there has to be a date. I mean,
Yeah.
because there has to be a date.
Yeah.
So whatever, I think whatever you want to do is fine, but I think it will keep getting pushed off because you're right. The elections used to be, we used to take nominations in October and vote at the December meeting. So we're already behind.
Yes. So I would make a motion to use for voting to use the 2020 and 2021 voting members list, and also wait to release until the voting platform until April 15th to allow checks that may be currently in process or en route to allow them to come in. If anyone wants to second that,
I'll second it. This is Itzy.
Thanks, Itzy. Right. Does anyone have any discussion or any comments on that? All right, so I'll say if anyone is opposed and wants to do something differently, go ahead and speak now. All right, so we'll go ahead and since there's not any opposition, we'll move forward. I will get the list from Kristen for the 2020 voting members, and also what comes in up until April 15th as far as dues for 2021 voting members. And I will send the election ballot as well as the bylaws out on the same platform on April 15th. All right, so only a couple minutes left for open discussion. Does anybody else have anything they want to throw out there before we adjourn?
Alex, this is Lynn. I got a quick comment, and maybe Diane could weigh in on this, but you said the Aaron Jennings is going to be the new director, the deputy director of trauma. Should we invite him to an OSTNL meeting to do like a 5-minute intro discussion talk, just so he feels really connected to us or some way like that?
I'm all for that, for sure.
I think that's a great idea, Lynn. Let me meet him in May and I'll make that offer to him to see if he could do our June meeting.
Okay. So Dan, if you just want to let me know what he says, that I'll send the invite to him. All right, anyone else?
Hi, Alex. This is Judy Keefe from Cleveland Clinic Akron General. I just wanted to very briefly mention, as part of Norton, we usually put on a big conference once a year, but we're not doing that this year due to COVID. So each one of the hospitals belonging to Norton are going to do their own EMS education series. And Cleveland Clinic Akron General is going to be June 3rd. And we're going to be highlighting a patient from basically the scene to when they were discharged. So we'll have EMS there. We'll have the doc that worked on them. And actually the patient himself is going to come and talk also. So I just wanted to let everybody know in OSTNL, I'll be sending, I was going to send Alex, I was going to send you the flyer with information on we're going to be streaming it live on how you can watch it. And I really hope all of you will watch it. And I think it's going to be very interesting. It's about a young kid who's a baseball player and got his hand cut off. And is back to playing baseball. So I will be sending that flyer out next week. If you could distribute it to the committee, I'd really appreciate it.
All right, awesome. Thanks, Judy. I will definitely get that out.
Thank you.
Is there anyone else that has anything? All right, well, if that's it, then I make a motion to adjourn if anyone wants to second.
This is Ann, I'll second.
All right, thank you. All right, so have a great, happy Easter, everyone, and enjoy your weekend.
Thanks, Alex. Happy Easter.
Thanks.
Thanks, Alex. Great job.
Thank you.
Good meeting.
Yeah, thanks, Alex. Great job.
Bye, everybody.
Happy Easter. Bye, guys.